What's up, everyone? Dr. Eric Jackson here. Hope you're all doing well, staying safe. So we're all in a state of flux, obviously. Certain states are talking about opening back up again, at least in some capacity. Others are not. There's also debate on whether that's going to include dentists in the first wave or the second wave or so on and so forth. So there's still quite a bit of questions. So I thought it'd be really a good idea to kind of summarize the last month of patient questions and whatnot that I've received. I've been doing obviously some phone calls with patients as well as virtual visits via the teledentistry option on RevenueWell that my office uses. They've been going very well. But there's a lot of similarities between some of these questions. So I thought we'd go through briefly, and especially pertinent for those who are going to be extending the stay at home. I know New York just extended it. But ultimately, I know the northwest part of the country is going to be without normal, we'll call it, normal elective type dentistry for quite a bit longer if they hold to their initial recommendations. So what do your patients, what do you as a patient need to do to stay healthy during this time? Well, the first thing is going to be basically, I'll remind you that this is why we have comprehensive regular dental care, right? We don't want to be going year to year or as emergencies as needed. We want to be going in for routine checkups, routine cleanings, because that way small problems can be identified when they're small, as opposed to sneaking up on you when they're large problems. And unfortunately, when most of the dental industry in Illinois and in America is more or less shut down. So sticking to 6 months. So going forward, keeping your 6 month checkups, adhering to your 6 month checkups, or 4 month or 3 months if that's your thing, is very important. Please do so. That's just my public service announcement for the day. Especially considering when we all get back, hygiene appointments, dental appointments will all be at a premium, obviously. There's going to be a glut of patients who want to get in. Please don't miss your appointment. Please don't blow it off. It is not something that is optional. It never was, but it certainly is not now. People want that spot. So please honor your commitment, honor your reservation. I've always compared it to a dinner reservation at a restaurant. It's important to have that mentality that you have been allowed that time slot for services to be rendered on you. All right. But with that said, what should you be doing in the meantime? Well, obviously keeping your oral hygiene high, high quality is important. Brushing 2 times a day for 2 minutes is always the key. We want to make sure we're impressing that upon not only ourselves, but our children as well. And if this is something that you've perhaps been lacking in the past, please really start driving it home, making sure that you're brushing everyone's teeth. I prefer up to 8 years old. I think that ultimately, at least me personally, at around 8 years old, kids can predictably brush well and understand why. I think flossing takes a little bit longer. You have to get a little bit older to get that rationale why. But under 8 years old, I think you should be monitoring those kids and brushing their teeth for them. The big thing here is that obviously, the old never share a toothbrush, sterilize your toothbrush. I think ultimately, since we're all kind of at home, the key here is don't share it with your family members. It's not something that most people do, I think, but ultimately, it's a good thing to say. We'll put it that way. Don't be sharing toothbrush head. Don't be sharing toothbrushes. Make sure you change your toothbrush. Speaking of which, I always advocate every 3 months. You can see some areas that are every 3 to 4 months, and that's just fine. But ultimately, if you're going 6 months or 12 months or longer, I've had people that had no idea that they had to change their toothbrush. It's like changing your tires in your car or any other part. The fibers, the filaments on the toothbrush head, they do wear out. They get soft and floppy, and they are no longer doing their jobs properly. So please make sure that you change your toothbrush head every 3 months. And if you don't have extra ones, we'll change it as soon as you can get to the store and buy one. Drink plenty of tap water. I've got prior videos on the importance of tap water and why the fluoride in it, but also that's pH balanced. Please don't be hydrating with carbonated beverages. I'll put a link to some of those prior videos above. pH is often overlooked in dentistry, and I think that the series, I think I made a four-part series a little bit of time ago, a couple months ago or so. I think they were great. I think that they are very informative, and I think that most people don't really understand that you shouldn't be drinking bubbly or LaCroix or whatnot, or sparkling anything as a main source of hydration. Remember, Diet Coke, Diet Pepsi, they have no sugar, but they have acid. LaCroix and bubbly, they're carbonated. They are acidic as well. So really, in a grand scheme of things, they are really no different than Diet Coke or Diet Pepsi. The difference is that people think they're water and they're hydrating with them. So please do not hydrate with your LaCroix. Please do not hydrate with anything like that. Drink properly pH balanced water. If you want to be a little more cutting edge, those alkaline waters are out there. You can try that as a new source of hydration. But truly, nothing beats properly pH balanced tap water. We here in Chicago, we have some of the best tap water, I think, in America. It's wonderful. So it's free, or more or less free. Drink it. Watch your diet. I mean, it's easy to say. We all were starting to get ready for spring break, shedding a few pounds, getting ready for swimsuit season, and all of a sudden then quarantine hit, and the carbs and the snacks and everything else hit, and that undid all the slim and trimness of the cut down prior to spring break. So this is something that I think we should try to strive for. We don't want to keep going that direction for our waistline, for our overall medical health, but also because we want to make sure that it's for our dental health as well. If you're not brushing the way you should, you've got to make sure that your diet is helping as well. But really, everything goes together. So brush well, good oral hygiene, good diet, and that way you're not coming out of this quarantine with a mouthful of cavities and problems. Finally, the last little bit I think I would say is try to be as healthy as you can. It's easy to say, hard to do, even without the extra stress and anxiety of coronavirus lockdown or quarantine or shelter at home or whatever you want to call it. Being cooped up in the same place, whether you're single without children or married with 4 kids like I am, it's a lot. And so easy to say regular exercise, easy to say, watch your diet, minimal alcohol, stop smoking. All these things apply to so many of us, but try your very best to do them. Your body will thank you for it in the long run. Ultimately, you're probably overdue. Some of you might be overdue for dental cleaning. That's unfortunately the world we live in right now. Keep brushing. If your gums are bleeding, brush gently, but you need to keep brushing. Don't stop brushing because of the blood. Also, I'll point out that your gums really shouldn't be, if you've been keeping regular hygiene visits, you shouldn't be gushing blood anyways. And if there is a copious amount of blood, you need to have some a good thorough examination as soon as you can, because there might be some periodontal disease, gum disease cooking in there. So ultimately, we want to make sure that we don't stop brushing. If we see any blood, that is a big no-no. Brush gently and ignore the blood, and then get in to see your dentist and dental hygienist as soon as you can. I've had a lot of questions about patients or from patients, both that are part of my office and others that, just via email that aren't. What do I do if this, that, and a couple of the more prominent questions were, what do I do if I'm in the middle of treatment that's not done, like in the middle of periodontal treatment? 2 quads of the 4 were done with the scaling root planing. Well, ultimately, there's not much else you can really do. Call your provider, call your dentist, call your periodontist, whoever was doing the work, ask him or her for their opinion. B, excellent oral hygiene. Remember, floss, brush, rinse is my mantra. Floss first, then brush, then rinse with a good rinse like Listerine. Or if you're a periodontal patient, you might have a prescriptions type rinse like Paradex, a chlorhexidine type rinse. That's a kind of important thing to keep high quality and oral hygiene. You know, for untreated dental cavities, I've had some patients say, "Oh, I've got a cavity. It needs to get done because I know it's getting bigger." It's not painful, so therefore it's not on the radar of emergency dentistry. But it doesn't mean it's not important, and I make sure I let them know it is important still. And this is the kind of thing where if it was diagnosed just moments before the shutdown, that is an unfortunate reality. But if it was diagnosed 6 months, 9 months, 12 months ago, that's something that needs to be impressed upon the patient, that this is why we don't put off things. Dental offices have a lot of different financial options, whether you have insurance, whether you don't have insurance, payment plans, third-party options, a whole slew of things. Again, talk to your dentist, talk to your provider, say, hey, I don't want to put this off any longer than I have to, because here we are in an emergency situation, probably the worst that we're hopefully ever going to see in our professional careers and our lifetimes, as far as interruption to society and the fabric of society. But don't put off what you can do today. You know, don't put off till tomorrow what you can do today, right? That's what I was trying to say. It's an old adage, but it's very, very true. Get your work done as soon as you can, and then everyone's happy. Your dentist, your mouth, your teeth, your gums, and more importantly, the patient, who is the owner, I guess we'll say, of the cavity and the tooth. They'll know that it's done. Don't put off the work. And finally, if you have other things in the mouth, like a temporary crown that's still holding and hasn't had the final crown put on yet, just make sure you're keeping it clean. You're not being aggressive with it. A lot of it comes down to choices. If your passion during this quarantine is eating peanut brittle and rocks, not a good choice. Please eat and respect the fact that the temporary itself is not a final restoration. The temporary cement is not final cement. Avoid things that are super hard. Avoid things that are super sticky, because hopefully we're past the halfway point. And even if we're not, the advice is sound. Take care of it. Don't live in fear of your temporary crown. But ultimately, it's not final. Don't treat it as such. Thanks for listening. I hope some of these thoughts and tidbits were worthwhile. You can pass along to your patients. If you are a patient, pass along to your friends and family. Dentists are in a hard spot right now. We don't have carry-out. We don't really have any way to make money. We're basically in a shutdown. Most dental offices don't do gift cards. And I know that restaurants and service industries are getting a lot of love and affection, and I think that's very worthwhile. But I want to make sure that I send my love and affection to the dental industry, to the dentist, to the dental hygienist, to the assistants, to the administrative patient coordinators. I wish you all the best. I hope that we all get back to work soon, and I hope that small business dentistry is able to recover from this quickly, effectively, and fully. One final thought, I will suggest, if you have a dentist office that you love, especially if they're a small business, go ahead and jump online. Go on Google, go on Facebook, write them a review. They would love to get a positive review from somebody right now. This is when you can give back to that office for all those wonderful years of service. Give them a positive review. Give them some words of encouragement online. I promise it will go a long way to getting the providers through this, because much like the patients, we are suffering as well. We want to be there. We want to be caring for basically our extended family, is how I say it. You know, those couple thousand patients per dentist, that is the average. We see those patients for 30 years. They are family, and to be separated from family is hard. So go online, review, and give some positive vibes. So thanks for watching the video. As always, give it a like if you liked it, subscribe and share, always appreciated. Subscribe to the channel, always very important. Make sure you hit the bell when you do subscribe, because that way it'll pop up on your phone when a new video drops. Leave questions and comments below. I wish you all the best. Hang in there. One day at a time is how I've been saying it to myself and to others. Good days come, bad days come. Sometimes it's hour by hour, frankly. You hear something on the news, it brings up your spirits. If it's something else on the news, it brings down your spirits. Hopefully the average is neutral or positive, and we'll see you soon in the office. Take care now. Bye-bye.